morning, everyone. In these strange COVID times, welcome to the virtual launch of our annual review. You'll bear with us if there are glitches or hiccups, I'm sure. The focus currently is on lockdown and all that we cannot do as a nation. We in Merchants Quay witness our clients experiencing lockout and all its deprivations. Little or no access to toilet facilities, no place to have a shower or even wash. Basic human rights. We will explore the impact of COVID on our most marginalised clients much later in a panel discussion. As always, it was a busy year with lots of activity. Merchants Quay board members, management and staff are focused on delivering quality outcomes. Our vision is that everyone should have the opportunity to overcome addiction, never go hungry, have a roof over their heads, and be treated with respect and dignity at all times, and live a fulfilled and productive life. It is the responsibility of the board of Merchants Quay to ensure that we have a well-governed, efficient organisation which is fit for purpose to meet client needs. This is particularly important in the current climate. In this regard, we're proud to be part of the triple lock concept of good governance. Our accounts are SORP compliant. We have adopted and comply with the Good Governance Code, and we have formally adopted the guidelines for charitable organisations on fundraising from the public. And again this year, our finance team, headed up by Jennifer Owens, won the Charity Institute's award for the best finance team in Ireland. Well done and congratulations to Jen and the team. Merchants Quay won a tender process in 2017 to pilot a medically supervised safe injecting facility in Dublin. Given that we are now 3 years on from the award of the tender, and the fact that objections still exist to the medically supervised injecting facility, it seems important to restate the purpose of delivering this essential service. A supervised injecting facility is a clean, safe healthcare environment where people can inject drugs obtained elsewhere under the supervision of trained health professionals. These professionals offer a compassionate, person-centred service which reduces the harm associated with injecting drug use and can help people access appropriate services. A supervised injecting facility can help our health service staff to reach and support vulnerable and marginalised people who often do not, cannot, or no longer engage with the existing health services. A supervised injecting facility aims to reduce drug-related overdose deaths, reduce the risks of disease transmission through shared needles, reduce public health risks such as needle stick injuries, reduce antisocial behaviour and the proliferation of dangerous discarded drug paraphernalia. It also aims to connect with the most vulnerable and marginalised people who use drugs with treatment services and other health and social services. It is imperative that we are facilitators in delivering this service, given that there were 786 drug-related deaths in Ireland in the latest reported figures in 2017. It is our intention to run this new service to the highest standards of excellence. All the international evidence indicates that lives will be saved. It is a real tragedy that homelessness continues to be the loss of the majority of our clients, and there is a genuine concern that as a society we're becoming impervious to the human cost to very real people of this national disgrace. Merchants Quay offers emergency shelter and outreach services to provide people who are homeless with a place of welcome, warmth and safety. We will continue to advocate strongly on behalf of our clients, most of whom are at the bottom of the concern pyramid, as they tend to be single and forgotten. Our donors have continued to respond with incredible generosity to Merchants Quay. To all our donors, whether they are statutory, corporate or personal, we say a heartfelt thank you. Without your extraordinary generosity, many would go hungry and indeed some would undoubtedly die. The Franciscan community continue to support Merchants Quay with a quiet generosity. On behalf of the executive, staff and clients, I want to express our gratitude to them. The Franciscan ethos is a firm and safe scaffold for all that we do. Personally and on all our behalves, I want to thank our Chief Executive, Paula Byrne, who continues to be a strong and dynamic leader. Her energy, commitment and passion as Chief Executive contributes to the high standard of excellence achieved by the organisation. I want to express our deep gratitude to our executive team, to our staff and our volunteers. All at Merchants Quay continue to go the extra mile for our clients. Members of the board of Merchants Quay contribute their time and expertise on a voluntary basis, and I personally thank each one of them for their guidance to me and their strong commitment to achieving Merchants Quay's objectives. The Gardaí and ambulance services invariably show great sensitivity and compassion in working with us and our clients. This is very much appreciated. This will be my last year on the board of Merchants Quay, and I want to acknowledge the honour and privilege it has been over the past 10 years to be involved with such a fine organisation, and to express my gratitude to the many great people I have met at all levels of Merchants Quay during this time. I want to welcome Ray Langton, the incoming chair, and I'm sure you will all join me in wishing him well in his new role. At Merchants Quay, we want all who visit our services in any capacity to feel warmly and unconditionally welcome. It is our firm wish that through our work, we will continue to improve the lives of our clients. Thank you. And I now want to hand over to Paula Byrne, our Chief Executive.
Thank you, Mick. Good morning, everybody, and welcome to the launch of Merchants Quay's annual review for 2019. Merchants Quay's clients are the visible face of homelessness, people for whom this means being out in all weathers, with inadequate clothing and poor nutrition. Often this is compounded by addiction and mental health issues. In a year when homelessness was never far from the headlines, the annual review reflects the complex needs of people who are homeless. Last year in Riverbank, of the people who accessed the service, over 5,000 were aged between 25 and 55, and another 515 people were over the age of 55. Over 1,000 women attended our services, with 128 women attending our gender-specific activities. Of the 564 young people who are between the ages of 18 and 25, who engaged with us, 86% were homeless or came from state care. Over 1,000 of people of those accessing our services were foreign nationals from both the EU and farther afield. Homelessness in itself is a trauma and leaves lasting impacts on physical and mental health. 1,985 unique individuals paid over 9,000 visits to our primary health care, which includes our GPs, general nurse, chiropodist, dentist and counsellor. A further 433 individuals were supported by our mental health team. In our harm reduction services, 3,140 individuals were supported by staff with 30,644 needle exchange visits. 69 people accessed our community benzo and alcohol detox, and in the regions, 787 people accessed our drug and alcohol treatment support service in the Midlands, and a further 139 people attended our CRIF service in the East Coast. We recognise the importance of enabling people that we support to stay well. This is crucial for individuals in maintaining their health and well-being and supporting their recovery journeys. People can and do recover from addiction and go on to live full and active lives, but recovery relies on people having access to the supports they need when they need them. Our recovery services received over 900 referrals to our detox and rehab services, and we provided treatment for 181 people who wish to become drug-free. Over 2,000 people received in-prison addiction counselling, and 25 people attended our aftercare services and lived in our supporting housing units. A continuing theme among those in recovery is the lack of housing for people exiting rehabilitation. And in the current housing crisis, many of these, on completion of treatment, are unable to access suitable accommodation. If we seriously want to address drug and alcohol addiction, investment in supported housing post-treatment with appropriate wraparound services must be prioritised as a matter of urgency. Within the National Drug Strategy, it is acknowledged that women can experience barriers to engaging and sustaining involvement with treatment and rehabilitation services. We secured funding through the South Inner City Drugs and Alcohol Task Force to undertake action research conducted by Dr. Sarah Morton, Director of Community Partnership and Drug Programmes in UCD, to explore the challenges surrounding access to addiction, health and homeless services for women. We believe that this research will contribute significantly to how we engage with women in services going forward. However, funding is needed to develop more gender-specific services like women's services. I would like to call on Minister Fian to support this important initiative and to make the necessary funding available to support women to engage with services, to address their issues of addiction, homelessness and the trauma which has impacted their lives. On Christmas Eve, An Bord Pleanála announced that planning permission was granted for the medically supervised injecting facility, a service which will save lives that could otherwise be lost to overdose, while also linking people into services such as detox and rehabilitation. We acknowledge the support of the government to date, and we look forward to working with Minister Fian on this important initiative, which is part of our National Drug Strategy and the programme for government. I would also like to thank those who supported our social media campaign to raise awareness of this vital service, and it would be remiss of me not to mention Brendan Courtney, a neighbour who played a major part in this campaign. Addiction is common across Ireland. We know that. There is barely a family that has not been touched by either drugs or alcohol addiction, yet it is rarely spoken about. News headlines focus on crime and statistics. We do not often hear about the complex day-to-day reality of addiction and recovery. Working with Dr. Maria Quinlan and Patrick Bulger, we provided a safe space for people to share their lived experience of addiction through stories and paragraphs. The shame and stigma around addiction is real. We need to talk honestly and openly about addiction. It is in the sharing of stories and people's reality that we begin to understand. I would like to say a special word of thanks to all our clients and family members for courageously participating in this project. I would also like to extend our deepest appreciation and gratitude to Maria and Patrick for facilitating this research project with such compassion, understanding and integrity. I would like to acknowledge our colleagues across the statutory, voluntary and community sectors who work closely with this on a day-to-day basis in the provision of services to drug users and people who are homeless. Of course, all our services require funding, and in this regard, I would like to thank our colleagues in the Department of Health, the HSE, the Irish Prison Service, the Dublin Regional Homeless Executive, the Probation Service, TUSLA, and the regional and local drug and alcohol task forces. Alongside the statutory support, a significant proportion of our funding comes from voluntary income. I want to particularly acknowledge and thank all our individual donors, companies and grant-making trusts that support our work. It is this support that makes so many of our services possible. Thank you. I would also like to thank our board and the Franciscan Fraternity for their ongoing support. It is hard to reflect on 2019 without thinking about how drastically things changed for us all this year in such a short space of time. For us all, COVID-19 has brought about changes in both our personal and professional lives. Dealing with change in every aspect of our lives brings with it increased uncertainty and anxiety. Despite this, what we have achieved through the staff's hard work and commitment over the last few months has been incredible, and I want to pay tribute to that. Given the fears we all have for ourselves and our families, their dedication to the people we work with is second to none. I am very proud to work with such a remarkable bunch of people. We have maintained our services, albeit operating them differently. And for our service users who avail of our day services across the country, this has meant a loss of human connection with our staff. They have found themselves even more isolated, which in turn has affected their mental health. This impact of COVID on mental health will be explored more in the discussion with Dr. Joanne Fenton and Sheena Walsh, who is our mental health nurse. Before I finish, I would like to read a letter from one of our clients who was cocooning earlier on in the year. It's such a long time since I've attended Merchants Quay. First of all, I hope all of you are safe and well. I need all of you to know that your service has been a huge part of my life for some time now, and without doubt, I miss it dearly. So until we meet again, all of you are in my thoughts always. NB, even though we are apart, we are still together. Thank you. I would like to hand you back to Mick.
Thank you, Paula, for such thought-provoking commentary, and I'm sure it will give us a lot to reflect on as we go forward. I'm particularly delighted that the Minister, Frank Fian, can join us now. Frank is the Minister for State for Public Health, Wellbeing and the National Drug Strategy, having been appointed in July last. He's been a TD for Sligo Leitrim since 2020 and previously from 2007 to 2016 for the Roscommon South Leitrim constituency. Previously, he served as a senator on the administrative panel, having been appointed by the Taoiseach. He doesn't know it, but we're almost neighbours, as I'm originally from Sligo, just over the Curlews from the Minister's home base. So you're very welcome, Minister, and the podium is now yours.
Ladies and gentlemen, may I start by thanking Merchants Quay Ireland for inviting me to launch their annual review for 2019. The COVID-19 pandemic has created a time of uncertainty and anxiety for everyone, and particularly for those who are affected by drug and alcohol addiction. The restructuring of services, social distancing measures and self-isolation can be particularly difficult for those who are affected by drug or alcohol addiction and those who are in recovery. I would like to commend Merchants Quay Ireland for continuing to provide services to people who are homeless and drug users during COVID-19 as part of the HSE-led Dublin COVID-19 response team. I am aware and appreciate that you've had to adapt new ways of working to continue to support people affected by substance misuse during the pandemic. We have learned a lot of important lessons about caring for people who are homeless and in addiction during COVID-19. I want to assure you that the government will retain the specific actions taken to support people who are homeless and in addiction during COVID-19. To this end, the government is providing a further 11 million in 2021 for COVID-19 specific initiatives in the HSE Winter Plan and COVID-19 Pandemic Plan. The health needs of people who are homeless and in addiction transcend the immediate challenge that is COVID-19. We need a long-term strategy to address homelessness. The programme for government commits to develop health and social interventions based on an inclusion health approach to target people who are homeless and in addiction, addressing the needs of homeless persons and improving their access to healthcare is a key priority for the Department of Health and the HSE. In Budget 2021, the Department of Health is providing 4 million to address the addiction and mental health needs of people who are homeless. I note that today's launch includes a panel discussion on the mental health of those who are homeless, and I want to highlight a new initiative on this topic which was funded in Budget 2021. It is well documented that the homeless population have higher health needs, including a higher prevalence of mental illness than the housed community. Rates of self-harm, suicidal ideation and attempted suicides are also high. People who are homeless are less likely to avail of primary care and preventative services. There is a tendency to present to acute services late on in the course of their illness when the condition is severe and so requiring hospitalisation. To ensure a cohesive strategic response to the mental health needs of people who are homeless, I provided funding to the HSE to develop an innovative stepped model of mental health care in the Dublin region. This service will develop mental health care pathways for the homeless population into and between primary care addiction services and specialist mental health services. Further resource specialist mental health homeless teams to provide coordination, governance, clinical expertise and training advice to the best need to meet the needs of the homeless population. Overall, the new service will be dynamic, recovery focused and integrate mental and physical health in transitioning people back to mainstream health services, housing and their communities. Further information on this step model of mental health care will be contained in the HSE National Service Plan for 2021. To conclude, I would like to acknowledge the good work undertaken by Merchants Quay Ireland in the spirit of the caring Franciscan tradition with some of the most vulnerable groups in our society in 2019. The range of the services provided by the Merchants Quay Ireland is helping over 11,600 individuals in 2019 is truly impressive. In delivering these services, Merchants Quay Ireland has developed extensive partnerships with the Department of Health and the HSE. One such partnership is the establishment of a supervised injection facility to reduce the significant number of preventable deaths due to drug overdoses in Dublin city centre. The government remains supportive of the establishment of a medically supervised injection facility in Dublin City, which is a key action in the National Drug Strategy, reducing harm, supporting recovery. I wish your organisation continued success in the provision of services to those who are the most marginalised and would like to assure you of my department's continuing support for your vital work in addressing homelessness and addiction.
Thank you very much, Minister, for your fulsome contributions and indeed for being with us today. And given your recent appointment as Minister, I want to congratulate you and wish you well in the role. We're now going to break out into a panel discussion, which I will host, the purpose being to discuss the impact of COVID on the mental health of our clients and indeed on the morale and mental health of our staff. Joining me for our panel discussion now, we have Dr. Joanne Fenton, Sheena Walsh and Paula Byrne. Joanne has been a member of our board since 2012. She is a consultant perinatal psychiatrist in the Coombe Women's and Infants University Hospital in Dublin and a consultant psychiatrist with the homeless in Dublin South City since 2004, a joint role that she has held since then. Sheena Walsh heads up our mental health team, working with our clients that often suffer from dual diagnosis. She's based in the Riverbank, but also looks after the outreach programme in respect of clients' mental health. And Paula Byrne is our chief executive, who has been working with Merchants Quay for the best part of 20 years and probably covered every aspect of the business at this stage. So I'm going to start off with a very obvious question, and that's that COVID-19 has been difficult for the whole population to deal with for the past 6 to 7 months. Everybody talking now about difficulties with mental health issues around isolation, lack of social contact, etc. And I'm wondering what the impact has been like for the clients, for the Merchants Quay clients that you're coming across on the streets or in our services day by day. Sheena, you might talk about that to start.
Hi, Mick. How's it going? Yeah, so I suppose you're talking about a cohort of people that experience isolation 365 days a year. And I suppose COVID has magnified that for them in terms of access and services. In Riverbank here, we've had to reduce the services offered to clients for their safety, really. So you're taking away, to start with, basics, access to showers, toilet facilities, a change of clothes, and even, I suppose, what Merchants Quay prides itself on is someone coming in and just having a chat and a cup of tea with a staff member. You'd often have heard people, and I've often sat with people, would say to me that they haven't actually spoke to anybody all day long until they've come into Riverbank and had an opportunity, I suppose, to sit with a staff member and have that face-to-face interaction. So I suppose, yeah, it's magnified that. And in terms of mental health, working with myself, not being able to do one-to-one interventions is extremely difficult. It's extremely difficult to even, I suppose, assess somebody. What we're doing at the moment is over the phone. A huge part, I suppose, in psychiatry is assessing the whole individual, their behaviours, and it's more than, I suppose, language and words. It's how they're acting and the way they're presenting. And I suppose the fear is, Mick, that people who are very sick are going to start to fall through the cracks due to this pandemic.
And I wonder, if I were to move it over to Joanne, dealing with the underlying conditions, would you say that their welfare has been, their conditions have been exaggerated as a result of COVID and what Sheena has spoken about?
Yes, Mick, I would agree that COVID has had a huge impact on the patients and clients attending Merchants Quay. We know that homeless people have a greater incidence of mental illness, including depression and anxiety, and severe mental illness and substance misuse. And with COVID, the very nature of it being infectious and contagious has separated and marginalised the clients that attend Merchants Quay hugely, and that has actually even heightened their mental illness, which is very, very difficult. And it's both difficult for the clients and also the staff, because the whole nature of the work that we do has changed. And as Sheena said, how we invite people in normally to Riverbank, the services shut initially and now have changed to a different outreach capacity, but it's new ways of working. So it's both impacted on our clients and patients, and also on the staff working in Merchants Quay.
And Sheena, just to go back to you, if we were to put a human narrative or story or face on a daily experience with our clients, what would be a typical day, and what sort of awful situations are you coming across on an individual by individual basis?
Yeah, I suppose there's many of them, Mick, but what's sticking out to me is I've had, I suppose, a female client that I've been working with for quite a while, who now at the moment is ready to move on to treatment. And unfortunately, due to bed capacity and things changing, not just in Merchants Quay, but in other services, the bed isn't actually there for her. So what we normally do is encourage a motivational interview, and to get someone to a point, it's nearly now trying to hold someone at what they're at, because we're looking at 2021 before this lady will have a female bed in any treatment centre. And it's trying to keep that motivation going in her. I suppose from what we would have normally been encouraging people to, go at the right pace, and she's fully ready to go there. But the system just isn't, it's not there for her. The bed isn't there due to the reduced bed capacity. In terms, I suppose,
and I'm sure,
sorry.
Just to move it over to Joanne, in the context of where that sort of disappointment occurs around access to the ongoing programme, if you like, I'm sure that it must heighten the prospect of relapse and therefore depression, etc., in the context of the client and their families even.
Yes, huge amount of work goes into motivating an individual to follow their treatment goal of maintaining abstinence and getting into a treatment program. And then all of a sudden, when March hit and COVID hit, things services really closed down, and it was much more difficult to engage a patient. And so we were left very much trying to make telephone contact with an individual. But as Sheena says, there's nothing like the face-to-face which Riverbank and the day services have been able to provide. It's absolutely key when you talk to an individual. They mention again and again what it means to come in, have a cup of tea, be able to get clean clothes and a shower, and be able to sit and talk to whether it be another client or also a staff member. And we can't emphasize enough how much that has impacted on our patients, and that causes increased anxiety, depression, and also a higher incidence of a relapse of severe mental illness due to the isolation and lack of contact. So I suppose we can't just highlight enough the impact of COVID on our services, which we need to change.
And Paula, just to bring you into it from an executive perspective, presumably back in March, it must have been a logistical nightmare to manage a situation where there would have been up to 300 people looking to access the riverbank, the flagship Merchants Quay building on the quay, and suddenly for that not to be available to us. Can you talk a little bit about that in terms of the impact on the client and indeed on the team?
Yes, Mick, I think the first thing was the suddenness, I think, is what we all recognise, besides ourselves trying to get organised. We split services into different buildings, but you can imagine the confusion for clients, and suddenly they find themselves, at closed doors. And that was very difficult, and even trying to give clients directions to go to another building to access food and that. So to be fair, they were probably very bewildered. We were probably, to be honest, in a spin. Nobody has ever been faced with such a pandemic crisis. So I think it had an impact on both clients and staff, but particularly clients. So we had to rapidly adjust to how we provided our services while we continued to have them all operating. So from Riverbank's point of view, we had to suddenly use takeout. People other than those attending the primary healthcare actually couldn't come into the building. So in order to try and connect and stay connected with some of the clients, we've had to change our services into outreach on the streets. As Sheena said, it's really important for people that are suffering with anxiety, depression and mental illnesses to keep connected. So I suppose technology became a bigger part of our world in terms of using, iPhones and Zoom to try and keep that social connection going with clients.
And to bring it back again to Sheena and to have it client focused, I suppose pre-COVID, a lot of our clients would have said that they were amongst the most marginalised and ostracised in our community. Has that been exaggerated because of COVID? I mean, what do the clients say they missed the most?
Yeah, I think hugely. I mean, if you go through, and certainly through these lockdowns, if you're walking through Temple Bar, O'Connell Street, you're not seeing anybody except those that are left on the street. So you have people, I suppose, out all day, every day, no access to services, nowhere to go, nowhere to shelter. You're looking at a stage where it's coming into winter. I mean, I started here at Merchants Quay last winter, Mick, where the place was, busy would be an understatement. That's what we're looking at facing, I suppose, still that level of clients that are now out on the streets. Obviously, there is isolation hostels and hotels that are happening, but you still have a huge amount of rough sleepers who are being missed, and it's only now, I think, that you're getting to see them when you're walking the streets and it's empty. It's kind of harrowing to see, to be honest with you.
Joanne, given that you've been engaged with the homeless for the best part of 20 years, would you agree with what Sheena is saying, that there's an absolutely exaggerated impact in terms of that sort of ostracisation?
Absolutely. I think the homeless people already, their voice is often not heard, and they're more marginalised and isolated. And when COVID hit, people retreated themselves, they retreated into their own homes, and then you were left with homeless people, often people sleeping rough without any, with minimal supports, and actually really not knowing where to access it. There was also a lot of misinformation about COVID initially, about how it could be spread. And again and again, we're just trying to educate the homeless individuals and just give them more support. So that would be my opinion.
And the clients themselves, are they saying that there are specific aspects of the service that they're missing? Is it the human face? Is it the social exchange? Is it the delivery of services? Have they identified what's the glaring gap at the moment? Do they talk about that?
Yeah, I suppose, yeah, people that I'm speaking to, whether it be over the phone or at the door of Riverbank, yeah, it's coming in and having a conversation with people. A lot of people, I suppose, no access to showers, out all day, no access to toilets, people using baby wipes to wash themselves in alleys and in parks, you know. They're obviously missing coming into the building for whatever purpose they came in here for, whether it just be for a chat or to use the facilities. They were always kind of welcomed, I suppose, and they don't have that at the moment.
It sounds like a horrendous loss of basic human rights. And, I'm wondering if Joanne and Paula might engage with, are there possible addresses to that deprivation of just not having a place to wash, the access to toilet facilities being just really not available? Have we thought about that as an organisation or with the state?
I think, Mick, I think, as Sheena said, it's the glaringly obvious lack for people that are living on the streets. And what we've tried to do is we've done some building work around our own showers and toilet blocks to try and facilitate people coming in. But currently we're able to offer some limited access to showers and toilets. We would hope to develop that, and we're trying to look at some other options. The idea is that the outreach team who are linking in with people on the streets will be able to bring people in for showers. However, I suppose just in the context of public health requirements, we can only do a few a day, which isn't enough to support the people that are living on the streets. There's more to be done, and I think we're looking at options on how we might do that.
Joanne, I'm sure it must be having a debilitating effect on people, yeah?
Absolutely. There was, there's been an increase in psychiatric individuals presenting for support here with me on the Access team, and also with my colleague on the Northside Programme for the Homeless. There was also initially a real fear of going to the hospital, and I think people, individuals with general medical conditions were afraid to present to the hospital. So that was even magnified for homeless people, and now people, homeless individuals, are presenting a little bit more. But again, it's difficult to access care, and I suppose they would feel, and often myself and colleagues working with homeless people would see homeless people down. There's a huge stigma, and they are often not prioritise their needs. And again, we need to advocate and ensure that their voice is heard, because they are no less than anyone else, and need to be heard and supported. And that's really what Merchants Quay is about.
And to move it into the future, if you like, I'm sure back in March there must have been a paradigm shift in how we met with and delivered services to people. That obviously provokes challenges, but it also allows for creativity and innovative approaches to how we might engage with that client base into the future. Is there any coherent thinking beginning to occur around that? What might the future look like whenever the pandemic settles back down?
I think, Mick, we've still held on to our core in terms of the clients, our number one priority. So I think, in fairness to the staff teams, they have just gelled together, and we're trying to look at solutions where we can reach out. I don't think we're at an infinite stop. I think we're going to see more movement, and we need to be agile to meet the needs of the clients. But I suppose having 4 outreach teams out on the streets to provide harm reduction support, but also to provide close support, just link in and being able to bring clients in to perhaps services like Sheena's or some of the primary health care. So I think outreach is definitely a priority. It's just even to be able to say hello to somebody on the streets. That might be enough for somebody on their first engagement. The second is to try and in-reach to units, as Sheena said, while people welcomed a roof over their heads, there's a loneliness in cocooning or shielding. So it is about making sure that there's some contact, be it by phone or, if we can, to actually go and physically meet somebody, subject to public health requirements. And obviously the one-to-ones that Sheena and Joanne have spoken about are vital for people. It's, phones are one thing, and they're great, as Sheena has often said, if you know the client. But if you're dealing with somebody that's new to the service, it's far better to see each other. So we've rented a new premises in city centre where we're hoping to facilitate one-to-one meetings with clients who particularly need that engagement if they're first approaching the service. And we expect an increase in the number of people that need mental health that are living on the streets or are just, as affected by COVID as the rest of us, but has a more impact on their mental health. So we will be looking at the team and hopefully expanding both our nursing teams. And for me, they're the priority. Technology obviously is we're never going to go back, I don't think, realistically to where we were at, but I think it's a blend of technology and trying to facilitate face-to-face engagement when we can.
And Joanne, given that the sort of physical medical world, even the GP practice now tends to do the initial assessment over the phone, is that a runner in terms of psychiatric well-being? Does it not require a more hands-on, face-to-face delivery, or do you think there's a virtual blended future, if there's such a phrase?
Yeah, no, I do think that there is definitely a future in telepsychiatry and phone-to-phone contact. It certainly will never surpass the one-to-one contact that you have with an individual, and particularly, as Paula says, in a first assessment, it's great if you can meet the individual. But I think we need to be able to adapt. I think what we really need to do is to avoid the social isolation and have a space which is comfortable and inviting for homeless individuals, because already they are very, very fearful both of COVID and their future. And in order to do that, we'll have to enhance the mental health teams, and I think we need to prioritise that. In addition, both the voluntary agencies and the statutory agencies need to work together, and we just need to highlight the homeless needs, because again and again, as I've said, their voice is often forgotten, and Merchants Quay is really a key runner in supporting them. So I think a blended is how we're going to go, but as much within public health guidance, as much face-to-face contact as we can.
And Sheena, to bring it back down to coalface or street level, I know one of the days recently you would have told me about a young woman that the team engaged with in the middle of the day outside the Gaiety, who had been sleeping rough for a few days, and that she was actually drenched and actually needed to be completely kitted out, as it were. How feasible or possible is it to begin to sort of countenance a virtual reality for that lady?
Yeah, well, I suppose the girl that you're speaking about just so had a relationship with two of the outreach workers that actually came across her. So in that circumstance, virtual, if they have access to a phone, Mick, and that's the other side of it. Like if people are out sleeping rough, and certainly anyone that I've worked with that's entrenched rough sleeping, they don't have phones. They don't often. People have come in and they may have been sleeping rough the night before and wake up with nothing. They don't have any of their belongings. I suppose for that girl going forward, I'm not sure if a virtual thing would work. I know that she did, the outreach team got her kind of dry and had got her new clothes, and she left after that. But since then, I'm not sure there's been any engagement from her. So I'm not sure in those circumstances, certainly with rough sleepers, and from who I've worked with, it's limited phone access what they have. You're looking at people who are sleeping out in Phoenix Park on the canal, and realistically, where are they going to charge that phone? Like prior to COVID, they may have come into Merchants Quay and done that, but now they can't, so is it really feasible for people who are out all day, every day to do virtual calls with people?
And if I were to address the same question to Paula and Joanne from a different angle, in third level education, for instance, there have been funding made available to provide sort of laptops, etc., to facilitate the virtual learning. Is that something that we should begin to think about, how we might bring the virtual world to the client? I know it's a provocative sort of angle to come at, because if we listen to the last story from Sheena, it seems next nigh impossible. But can we think about it, do you think?
No, I think that's exactly what we're trying to do with the teams, is to equip them with laptops or tablets and iPhones. I think we're possibly going to have spare ones, so that if we have to try and link people in from the streets, that there's one the client can use and then there's one for the worker to use. So I suppose that we're going to have to trial that, because obviously, if you have rough sleepers, they're not necessarily going to trust laptops or technology either. So I think there's a bit of work to be done, but you would hope with the more complex, needs of people, that we'd be able to bring them in. But again, as Sheena said, rough sleepers will, move around the city. You can't always assume that you're going to go back to the next day and find them in the same spot. We do know that people are moving further out from the city centre. So I think it is something we have to look at. But again, I think it has to be a combination of being able to bring people in when we can do so safely, and the use of technology. But it's working with the clients to get them to feel safe using technology with us.
Would you like to add to that, Joanne?
Yes, I know on the inpatient psychiatric wards that the patients were given access to tablets. Now, it's a different scenario, but they found it useful because there was no visiting and they weren't able to see any family. So I think there's definitely value in that. Again, I think I'd just like to highlight the amount of the different type of work the staff are doing, and so they're not used to doing the same kind of outreach work or the enhanced work. People were coming in and they were seen outside. So if we can avoid kind of staff burnout and support both the staff and the clients in using the new levels of, I suppose, technology and different platforms, then it's definitely a way forward. It's a different way of working, and certainly will never take away from the face-to-face, but it's certainly a space that we need to invest in and look at.
Well, you brought us to a juncture that I might give the final word to Paula, and that's about taking the temperature of the morale of the staff, because obviously it's been a horrendous 6 months or 7 months. Are we keenly aware of the impact on staff? Are we getting pushback from staff? I know it's a vocational field, but you might just give us your thoughts on that.
No, I think it's been very difficult few months. It's been an ever-changing world, particularly in Riverbank, from one week to the other since March. It's trying to look forward. I think we need to definitely look after the staff, because the impact, as Joanne had said, on the team, when they're used to being able to reach out to people and have that cup of tea or just a hello. So I do think there has to be more emphasis on looking at our staff. But to be fair to them, the priority is the clients, and they always bend backwards to ensure that we can deliver at least some of the services, albeit it's a big change in terms of how we're going to deliver into the future.
Okay, well, I'd just like to thank Joanne, Sheena and Paula for a very fulsome contribution, and I'm sure it's food for thought for all of us. So thank you very much. Well, thank you so much to everybody for being involved today. And just in conclusion, I want to say that our full financial report and statements will be available on our website, and indeed the team will be available to answer any questions that anybody may have. And the final word for me might be to be reminded of something one of our clients said to me a number of years ago, when I was going into our physical venue, and I stopped to say good morning and was asked what was on today. And when I mentioned it, I was asking what might make a difference to the clients. And he said, well, it would be great if people would just say hello to me. Thank you all for being here.